Welcome, everyone, and thank you for joining us for today's OnBoard limited release webinar for healthcare providers. Before we begin today's presentation, I'd like to ask everyone to please keep your phone lines muted. At the end of the presentation, board and project leadership are on the call to answer as many of your questions as we can. To submit a question, please use the chat feature or the Q&A panel to send your questions to all panelists. And just a note, later this week, we will be emailing you all with OnBoard limited release resources for healthcare providers, including a recording of this webinar. To begin with today's agenda, I will now turn it over to the board's Communication and Outreach Manager, Pam Barnhart.
Thanks, Mike, and welcome everyone, and thank you for taking time to join us. Today, we'll begin with a condensed OnBoard limited release overview for healthcare providers. We covered this fully during our November webinar series, and in case you missed it, you can visit the resources page of the OnBoard section of the board's website, where you can view a recording of that webinar and others. Next, we will walk you through the prior authorization request and request for decision on unpaid medical bills, Form HP1, submission processes. Based on the questions we received during the November webinar series, we'll be walking through frequently asked questions from healthcare providers, let you know what's coming up next in the project timeline, and we'll leave plenty of time at the end to answer any additional questions you have today. Let's go ahead and get started with the project overview. This multi-year project initially began in the summer of 2019, with the full system being available in 2023. But we identified opportunities to implement some early process improvements and functionality sooner in what we are referring to as OnBoard limited release. OnBoard limited release is tentatively scheduled for release during the second quarter of 2021 and will include a new online process for prior approval requests, or PARs, as well as the online submission of Form HP1. No earlier than October 2021, Phase 2 will be available, which includes eClaims EDI 3.1, with the complete OnBoard system being available in 2023. To transition away from paper forms, limited release will move the prior authorization request, or PAR, process completely online and will include the following. The existing MG1 process will be known as confirmation in the new system and will be confirmation that the treatment the provider wishes to deliver is consistent with the medical treatment guidelines. MG2 will be known as variance. Special services, which includes the 12 medical treatment guideline related requests previously done using C4 auth, and greater than 1,000 will be used for non-MTG treatments costing more than $1,000. When use of limited release begins, paper form MG1, MG2, and C4 auth will be eliminated. Part of OnBoard limited release will be the introduction of a durable medical equipment, or DME, fee schedule that certain types of DME will require. There will also be PARs for non-MTG treatment costing $1,000 or less, and new medication PARs, as OnBoard limited release will be replacing the current drug formulary prior authorization request process. Similar to the current drug formulary prior authorization process, all completed PAR submissions will be transferred to the case folder in eCase for viewing. OnBoard limited release will also digitize and streamline the submission of HP1, requests for decision on unpaid medical bills, and healthcare providers will submit Form HP1 solely using the web-based limited release platform. I should note that the rest of the HP1 process will continue using the same procedures as it does today. Only the initial submission will be done using OnBoard limited release. Submitting a PAR begins with logging into the medical portal to access the OnBoard limited release dashboard. The dashboard serves as a home page in the OnBoard system, where you can sort the information by column to view the status of PAR submissions in progress and submit new PARs. To submit a PAR, healthcare providers or their delegated staff will select Submit an e-form at the top of the dashboard and enter the requested information. As a reminder, healthcare providers can assign delegates to fill out PAR or HP1 submissions on the healthcare provider's behalf. For example, a delegate may be office staff. The actual submission of the completed PAR or HP1 must be done by the medical provider themselves. The system will automatically detect the type of PAR a provider is attempting to submit based on the information being provided, such as CPT code, MTG site, body part information, and whether the requested treatment is consistent with the medical treatment guidelines. Reference documents can also be attached, such as medical records or progress notes. There will also be the ability to add additional PARs on a single submission. For example, a provider may want to submit PAR requests for lumbar fusion, post-operation physical therapy, and a back brace, which can all be added and requested via a single submission. The only exception to this is for medication PARs, which need to be submitted as an individual PAR for each medication being requested. The PAR is then submitted to the insurer, and the actual submission needs to be completed by the healthcare provider themselves, not their delegated staff. Following the November webinars, we received great questions from healthcare providers. Let's go over the most frequently asked questions so far. And just to note, we have developed documents that outline these FAQs and more that are available on the OnBoard section of our website under Resources. Let's start with this question here. Will OnBoard limited release replace the current New York State Workers' Compensation drug formulary? Yes, drug formulary submissions will be done in OnBoard limited release and will be referred to as medication PARs. Here's a screenshot example showing the option of selecting drug formulary in the system. Who can submit a prior authorization request? Board-authorized healthcare providers and out-of-state healthcare providers will submit all PAR types in the new system. Certain types of healthcare providers can only submit certain types of PARs. Healthcare providers can establish delegates who will have the ability to draft a prior authorization request completely. However, the final submission of the drafted PAR will need to be done by the treating healthcare provider. How will providers be notified with status updates? Providers and their delegates will have their own dashboard with a status column that will update PAR submissions to their most recent status and level of review. Providers and their delegates will also receive email or text message notifications informing them of an update and that their attention is needed. Will the OnBoard limited release dashboard show the healthcare provider's full history of PARs, or will it only show requests from mid-second quarter of 2021 and forward? OnBoard limited release will only show requests made after the new system is implemented. All requests made previous to the implementation of OnBoard limited release will continue in the previous process and be viewable within eCase. How will healthcare providers register and when? All online user administrators for the current medical portal and drug formulary systems will automatically be granted access to OnBoard limited release in the second quarter of 2021. This will enable administrators to add users to the additional roles that will be required for their organization, as well as add new notification emails. The administrator will use their medical portal or drug formulary login credentials to access OnBoard limited release. Will an insurer have the option to opt out of the attending doctor's request for optional prior approval and carrier's employer's response, Form MG1, in limited release? No. A confirmation PAR in OnBoard limited release, previously done using Form MG1, will be optional for the healthcare provider to submit. If a healthcare provider submits a confirmation PAR, the insurer's response will be mandatory. Will the patient's pharmacy be notified through OnBoard limited release once a medication is authorized? OnBoard limited release will notify the Pharmacy Benefit Manager, or PBM, if there is one, that a prior authorization request has been submitted, and whether it's been approved or denied for the release of the requested medication. In addition, insurers will be required to designate a PBM contact who will receive an email or text message notification of each decision throughout the review process. How was the denial of an MTG variance PAR, previously Form MG2, initiated? Insurers will receive Form MG2, known as an MTG variance and OnBoard limited release, from the healthcare provider in the new system. After they submit the denial of the submitted variance, it will go back to the healthcare provider's dashboard to escalate if desired. Does the system automatically know if a request is consistent with the medical treatment guidelines? No, the system will not automatically confirm whether treatment is consistent with the MTG. Part of the provider submission includes the provider denoting whether their requested treatment is consistent with an MTG. The insurer needs to review the request and respond whether or not they agree based on the specifics of the claimant's case. The MTG lookup tool, which will be available when OnBoard limited release is implemented, will make it quick and easy to search the MTGs. You can learn more about the MTG lookup tool by searching MTG lookup tool on the board's website. Can a medical report be uploaded with PAR submissions? Yes. When submitting a form in OnBoard limited release, there will be the option to upload an attachment of necessary documentation. Examples of attachment include, but are not limited to, diagnostic testing, diagnostic imaging, office notes from a specific visit, a letter of medical necessity, or an image from a surgical procedure. Will the current time periods for insurer response remain the same once the new system is implemented? Yes, all current timeframes for insurer review and response will remain the same as they are today. If an insurer does not respond within the designated timeframe, an order of the chair may be issued. If the insurer denies a Level 1 or Level 2 PAR, can they request an IME? If so, does the 30-day timeline remain in effect? Yes, an IME may be requested depending on the PAR type. In those cases, the insurer will indicate the decision to get an IME in the system within 5 days of the PAR being submitted. If the Level 1 or Level 2 reviewer decides they would like an IME, they would have to make that decision within this time frame and should not respond with an approval or denial until the IME has been completed, or before the time frame for response has expired to avoid an automatic order of the chair in the case of non-MTG or DME requests. Will a durable medical equipment DME fee schedule be included in limited release? Yes, the DME fee schedule will be available when OnBoard limited release is implemented. Some items on the DME fee schedule will require prior authorization and others will not. In addition to the DME fee schedule, other implementations are timing up with the availability of the new system, which we'll discuss here on the next slide. In addition to the DME fee schedule, as we move closer to OnBoard limited release being available, the board has made the decision to time up some other initiatives with OnBoard limited release as well. The deadline for prescription drug refill compliance has shifted to mid-second quarter of 2021. And as a reminder, the drug formulary as it currently stands will be replaced with the implementation of OnBoard limited release that will include the medication PAR process. The medical treatment guidelines listed here will also go in effect when the new system is available. There will be a new medical treatment guideline created for use of traumatic brain injury, and there will be revisions made to mid and low back, neck, shoulder, and knee. Training modules will be available on our website for both medical and non-medical professionals once the new and revised MTGs are implemented. The OnBoard webpage has been updated recently with content specific to healthcare providers. I'd like to walk you through where to find these resources and provide a preview of how the website will soon be redesigned to give healthcare providers their own page to find these resources in the future. As I just mentioned, the OnBoard webpage has been updated with new resources for healthcare providers. There is a fact sheet highlighting what healthcare providers need to know and a listing of frequently asked questions for the healthcare provider audience. These FAQs will be updated as we move forward. You can also view a history of our recorded presentations and PDF copies of our slide decks as well. We encourage you to take a look at these resources and to share them with your colleagues. Updates are coming to the website in the next month. Specific sections will be devoted for each stakeholder audience, such as a page for healthcare providers, where all materials relevant to you will be located for easy access. So keep an eye out for these updates. Up until OnBoard Limited Release becomes available, we'll continue hosting regular webinars to keep you informed and eventually train you on how to use the new system. In February, our webinars will focus on the registration process for access to OnBoard Limited Release that will be available later that month. We'll also walk you through some frequently asked questions based on the questions asked this month. So keep an eye out on your email for those webinar invitations. You've heard me mention training a couple of times, and you may be curious, how will healthcare providers be trained on using the new system? As we move closer to using limited release, the board will be providing plenty of opportunities to receive updates and training. We'll continue regular webinar sessions just like this one. Just prior to OnBoard Limited Release being available, we'll be delivering just-in-time training webinars to provide you with everything you need to know for day one. Guide materials and video tutorials will also be developed, and website content is being continuously refreshed to assist you along the way. To stay in the loop on when training resources and other engagement opportunities are available, we urge everyone to subscribe to receive WCB notifications. If you did not receive this invitation directly to today's webinar, visit wcb.ny.gov/onboard and select the Get Involved and Stay Informed tab to sign up to receive email notifications, to stay informed on resources, and to register for upcoming webinar and training opportunities. If you're currently an authorized provider, you will use your current drug formulary account information to use limited release. When use of OnBoard Limited Release begins, there will be additional links added to the medical portal pages. If you are not authorized to treat workers' comp patients in New York State, you can apply to become authorized now. To apply, visit the board's website, select Healthcare Providers, and then select Apply to become an authorized provider for more information. You should conduct a review of any current systems and procedures to identify potential impacts. After going live with OnBoard Limited Release, the board will no longer be using paper for PARs or HP1 submittals. So please ensure your procedures are in place for day one. Remember, only the submission of requests for decision on unpaid medical bills, Form HP1, will be done using OnBoard Limited Release. The rest of the HP1 review process will continue using the same process as it does today. We also encourage you to review the OnBoard webpage. The content featured there will provide you with an understanding of the changes associated with OnBoard Limited Release, including the latest provider-specific frequently asked questions, the fact sheet that I previously mentioned, and recordings of all of our webinars. This is all located under Resources on the OnBoard webpage. That concludes today's presentation, and it looks like we have plenty of time to answer your questions. But if you have any questions following this webinar, please email onboard@wcb.ny.gov. To stay connected, we encourage you to visit the OnBoard webpage frequently. This is also where you can subscribe to receive OnBoard news straight to your inbox, as I just mentioned. These communications will not only feature limited release updates, but we'll be distributing information about the broader OnBoard project as well. Thank you for your participation and interest in OnBoard Limited Release.